What are the different types of facelifts that are done? Well, this is important because marketing terms on Instagram have turned everything into a mirror. You see the vertical lift. You see the extended deep plane, the mini lift with smazectomy. You see so many different versions and names. Well, the whole reason to do facelift surgery is to be a surgeon that understands the anatomy and can apply any of these techniques to your condition. So for instance, if you don't need a lot of tightening of the underlying layer, it may not be necessary to do a more extensive deep plane facelift because there may be no added benefit. On the other hand, if you come in and you have certain features that require deep plane approaches, there's no question that this is going to give you a superior result. Not one size fits all. It's very important to understand this because somebody's going to sell you a facelift with a certain name, and you're going to think because you saw nice before and after pictures with that facelift with a certain name, that facelift applies to you. And unfortunately, that's not always the case. There are a few basic principles that I believe in that make facelift surgery better for everyone. One is the approach to the deep planes of the face. By this I mean not just a skin lift, not just removing or sewing the deeper layer like a MAC lift, but actually opening the deeper layer at the junction between the fixed and the mobile tissue of the deep layer called the superficial musculoaponeurotic system. SMAS is the name that we give it, the initials. But opening that layer, going into the deep planes of the face, and moving those deep planes are going to reconstruct the shape of the face, and the skin is simply going to lie on top of it. So you're not using the skin to pull, hence you're not going to have a facelift look. You're not going to have a windswept look. You're not going to look like an alien. So that's a very important aspect, is to apply the right facelift. Now the other area that becomes critical is the neck lift. The neck lift is not, again, a simple procedure. There may be up to 8-9 layers that need to be addressed. From the skin to the next layer down, the subcutaneous fat, to the bands that we see, the platysma muscle, to everything below there, including digastric muscles, which can be thicker bundles, submandibular glands, another muscle called the mylohyoid, the fat beneath the platysma, the hyoid bone, and so many other aspects of the deep neck need to be taken into consideration, again, depending on physical findings. So if you're talking to somebody who's always selling you or discussing the same technique for each patient, personally, I don't know how they can accomplish the goals each individual patient may present with. So it's very important to be kind of aware of all of these techniques, not just one. One of the reasons I travel around the world is not only because I'm asked to lecture about things I do, but because I'm constantly learning new techniques. To be a fool and ask a question once is really easy. To never ask a question and think you have all the answers, that is what I consider a fool for life. So it's very important to go out, find out what other people that I respect are doing. So when it comes to facelifts, not one size fits all, but the surgeon needs to be aware of all of these options and apply them to your specific physical findings. That's critical.